Hi guys, Dr. G here with day 20 of Checkups with Dr. G, and today I'm talking about PMS, or premenstrual syndrome. So much like the name states, the PMS begins at least 7 to 14 days prior to your menstrual cycle starting. If you've had PMS, if you know somebody that has had PMS, then you're probably familiar with some of the symptoms, such as mood swings, food cravings, breast tenderness, some bloating, fluid retention. You can also have anxiety, depression, some cloudiness of the mind, muscle and joint pain and tenderness, alcohol intolerance, acne, and there's just a whole lot of symptoms that can come along with having PMS. Some of the things that are thought to cause PMS include changes in hormones, changes in brain chemicals such as serotonin around the time of your menstrual cycle, and magnesium deficiency. So some of the factors that can make PMS worse, not necessarily risk factors, but if you're already dealing with PMS, it can make it worse, can be a lack of sleep, smoking, stress, diets that are high in caffeine, sugar, salt, and alcohol. So you want to be mindful of those things. And, when you are starting to get close to your cycle, if you're not going to cut them out altogether, at least reducing them as you get closer to your cycle. So, the things that you can do to kind of help your PMS include doing the liver cleanse or eating liver cleansing foods. There are supplements you can take for liver cleanse, but I recommend you speaking to your primary care physician or a naturopathic physician so that you can make sure there's no interactions between the herbs in the supplement and any medications you might already be on. And also so that you can get a good recommendation for the dose that you should take. So there are liver cleansing supplements out there. Milk thistle is a great herb for supporting the liver. Some of the foods that you can eat is dark leafy greens, carrots, beets, reducing foods that are high in sugar or high in fats and oils. All of those things will help to cleanse your liver. And the reason we focus on the liver is because your liver helps process estrogens. So you want to support your liver, especially prior to your cycle starting, so that you can reduce the symptoms of PMS. Another thing that you want to do is making sure that you have a high fiber diet that's going to help to bind some of those excess estrogens and pull them out of the body so that you're not having a lot of symptoms there. So you also just want to make sure that you are avoiding estrogenic foods such as soy or animal products. There are recommendations for eating more of a vegetarian based diet, especially around the time of your menstrual cycle. And you can also use progesterone, and you can use progesterone creams. A lot of people use those, or it can be taken orally to kind of help offset the changes in hormones. But as usual, guys, if you have any questions for specific recommendations or help with finding a supplement that's good for you, please feel free to reach out to me. You can comment below on this video. You can direct message me on Instagram, Twitter, or Facebook at wholeyouwithg. You can send me an email at wholeyouwithg@gmail.com. And again, my YouTube page is Whole You with Dr. G, and I'd be more than happy to help you guys to try to manage your PMS symptoms and hopefully eliminate the symptoms altogether. So this has been day 20 of Checkups with Dr. G. Tomorrow I will be back to talk about dysmenorrhea or painful periods. So I hope you guys have an amazing night, and I will talk to you guys tomorrow.